So microneedling is a procedure where we are using multiple needles to stimulate collagen and elastin. So there's kind of two main types of microneedling. We have microneedling that's usually performed by a pen. There's the skin pen, the Rejuva pen, and then we have microneedling with radiofrequency, where we add to the needling a radiofrequency pulse that is really good with tightening of the skin and can do some fat remodeling that standard radiofrequency would not be able to do. Also, with standard microneedling, it's really great for, anti-aging, fine lines. I love it for acne scarring, even some pitting scarring. Some of our patients who have darker skin types who may not qualify for certain procedures, standard microneedling is a great option for them. Most importantly, based off of your concerns, it's important to come in for a complimentary consultation, and we can assess if microneedling would be the right treatment for you. The biggest concerns most patients have are, is this going to be painful? How long is the downtime? There's very few adverse reactions to microneedling. Obviously, we wouldn't want skin that had some form of skin breakdown or an active burn, but all skin types are good candidates for microneedling. We do numb the area before we microneedle, so routinely the area is numbed for about 30 to 45 minutes prior to the treatment. The treatment does feel mildly uncomfortable. I would say the average patient, depending on their pain tolerance, is about a 1 to a 3. Microneedling with radiofrequency, depending on the device, can be a little bit more uncomfortable. And then in terms of downtime, there is very little downtime with standard microneedling. We usually say about 24 to 48 hours. When the patient leaves here, they are very red. They often, will have some bleeding, which is their own platelet-rich plasma, which we don't want to remove right away unless we are adding some sort of topical treatment that we want to absorb into the skin while the small microchannels are there. On average, probably 24 to 48 hours of downtime, so much less downtime than we see with many of our other procedures. There are several patients we see that are kind of split between, should I do a chemical peel? Should I have microneedling? Chemical peels are wonderful, but depending on the depth of the chemical peel, the type of chemical peel, you may have a mild sloughing, or you may have a more aggressive sloughing where you peel like a snake. Every patient is quite different. So if someone doesn't feel comfortable, whether it be at home or at work, with that peeling process, they may be a better candidate for microneedling.